Kim just segued me perfectly into myths versus facts. Each week on the show, what we do is we break it down. I'll have a statement, and my guest panelists will say either myth or fact. But this is, again, about setting the record straight when it comes to your health. And we're talking about ovarian cancer. So there's a lot of myths out there, and we want to set the truth, or tell the truth, better yet, and making sure that people have the right information moving forward. So here's the statement. I got first one for Dr. Imam on the phone. Here we go. I'm going to say a statement, and then you're going to say myth or fact. It's going to be kind of rapid fire, and you give us maybe a few sentences on why it's a myth or a fact. Here we go. First statement, Dr. Imam. The majority of women diagnosed with ovarian cancer do have early symptoms prior to diagnosis.
Myth, I believe. Again, it's very non-specific. I mean, yes, it's a fact. It's non-specific, yes. Sorry.
All right, very well.
We do have some non-specific symptoms, correct.
Thank you very much. And again, I know we talked a little bit about earlier that, you know, we want to make sure people, if they're sitting on symptoms for a long time, make sure you get seen, but let's make sure we get seen, though, which is the most important thing. Here we go. Kim, here we go. Statement, myth or fact. Here's a statement. Multiple treatment modalities exist for ovarian cancer depending on type and grade.
True.
All right, please explain.
Well, just as I said earlier, so depending on, there's various types of ovarian cancer. The biology is different. So it may be a pill, it may be IV chemotherapy, it may be, I mean, we even do very specialized surgery with intraperitoneal chemotherapy. So there's a lot of options based on what the patient's biology of their tumor is. So that's a true fact.
Thank you. Here we go. Here's a statement, Dr. Imam. Ovarian, oh, sorry, I'm going to say this one. I was looking at my list here. I like this one. A pap smear will detect ovarian cancer. Myth or fact?
Myth.
Please explain.
Pap smear is a cervical cancer screening tool. Very rarely, it has to be like a really advanced stage ovarian cancer to see any of those cells show up on a pap smear, but that's not really what the pap smear is designed for. So a pap smear, we're screening you for cervical cancer or not ovarian cancer.
All right, thank you. We were talking about this one. Here's the one for Kim. We were talking about this a little bit off air, but here we go. I'm going to read it anyways. Here's a statement. Using talcum powder when applied directly to the genital area can cause ovarian cancer. What's your thoughts?
True if you're the lawyer. I mean, they have been able to equate some correlation, but once again, how much and how much talc you have to use and how you use the talc, I think, I don't know that we know that, you know, what that means, you know. So just like we don't know how many cigarettes you have to smoke before you could get lung cancer, right? So I don't.
There you go. I think you answered it very well.
Yeah.
Here we go. Dr. Imam, here's a statement. Here's the statement. The CA-125 blood test and a transvaginal ultrasound are reliable screening tests for ovarian cancer.
Myth.
Please explain.
Definitely not reliable. As we mentioned, the CA-125 could be elevated in so many different conditions. The most prominent one is endometriosis. And really, especially in younger women, it's very common for it to be elevated. So we use them as ancillary tools, but not reliable screening tools for ovarian cancer.
All right, thank you. Here we go. Here's a statement, Kim. I like this one. Ovarian cysts always turn into ovarian cancer.
Myth.
Please explain.
Well, the cyst is a benign condition. Dr. Brown can probably speak to that a little bit better than I can, but ovarian cysts do not, it's not like all colon cancers start as a polyp. We know that. Not all ovarian cancers start as a cyst.
Thank you very much. Here we go, Dr. Imam. We'll do a couple more of these. Here it is. The human papilloma virus vaccine, the HPV vaccine, will help to reduce the risk of cervical cancer, but not ovarian cancer.
That's a fact.
All right.
Yes, it is designed for, reduction in cervical cancer. It has no benefit to reduce the ovarian cancer.
All right, thank you.
The ovarian cancer is not really related to HPV.
All right, thank you. Let's do this one. We'll do this last one here for Kim. Women who have had a hysterectomy cannot get ovarian cancer.
It's a myth, unless even if women who've actually even had their ovaries out, if they don't take the fallopian tubes, depending on what, can still develop ovarian cancer. I've had patients even that have had total abdominal hysterectomies present with fluid in the abdomen and it's ovarian.
Yeah.
So it comes
Ovarian
back ovarian cancer. So that is not 100% effective way to prevent ovarian cancer.
Thank you very much. So there you guys have it. We get myths versus facts again. So we got about